Tonight for Texas women after the first case of the Zika virus was transmitted in South Texas by a mosquito. This happened in Cameron County on the border with Mexico, just about 6 hours south of central Texas. The virus has been linked to birth defects in children.
Up until now, the only cases of the virus in Texas were travelers returning from other countries. One case of the virus was transmitted sexually, but that was also related to travel.
The big fear now is how many mosquitoes here in Texas are potentially infected. KXAN's Leslie Rangel looking into what the city of Austin is doing and why some people say they're concerned they could be infected as well.
The weather was good and we had a lot of fun. It's always with family.
Chris Chapa spent Thanksgiving in the Rio Grande Valley, where officials today announced Zika was transmitted locally.
This is what appears to be the first case acquired by a mosquito in Texas.
Chapa just got back home to central Texas on Sunday.
I just didn't think it was going to get to the valley. I didn't, but now it is. I saw a lot of kids that were bitten by mosquitoes, especially my nieces and nephews. So it's scary.
The state health department says right now Austinites shouldn't worry.
This is a single case, so not the kind of situation where we've seen ongoing, sustained transmission. So there's not, no call for a travel advisory or other travel guidance at this point.
Austin health officials are still collecting samples to check for the type of mosquitoes that carry Zika.
We've been in communication with the state health department that if we to get any local transmission, we would work together to identify what is the area of concern where there might be considered to be local transmission.
For now, experts suggest wearing mosquito spray and monitoring for any symptoms.
The first one I'm going to call is my sister-in-law, because she's the one that has kids and they have a couple of bites on their face.
In Austin, Leslie Rangel, KXAN News.
Health officials are concerned about the spread of this virus, but they say this is the best time of the year to learn about a local case. That's because we're nearing the end of mosquito season, and a freeze could significantly reduce the mosquito population and therefore the risk of the Zika virus. Starting tomorrow, women on Medicaid can get mosquito repellent for free. The Texas Health and Human Services Commission reinstated that benefit today through December. And we wanted to look at Florida and the success of the operation there fighting the Zika virus. Just a week ago, another Zika zone in the Miami Beach area has been lifted. That's because the health department had not had any new cases of a local transmission in 45 days. The zone there in Florida covered about 3 square miles. One of the tools helping, a new kind of sprayer. It's a turbine-style sprayer sending a Vectobac chemical into the air to prevent mosquito larvae. The material is biodegradable and environmentally sensitive, even for area drinking water. This was used specifically around Zika zones in South Florida.
The Centers for Disease Control has given Florida nearly $16.5 million in Zika-specific funding. The CDC has shelled out more than $29 million in public health emergency program monitoring for the state as well. Add the cost of advertising, brochures, and media outreach to warn people in Florida, and the state has sent material for more than 12,000 Zika virus antibody tests in the last 9 months. And in just the last month, the CDC has performed more than 1,500 tests on specimens in Florida. In short, a lot of resources are being thrown at this issue to keep the virus from spreading in areas of the U.S. The U.S. is trying to avoid the problem still being seen in Brazil. The government there reports more than 2,000 cases of microcephaly or brain malformations in just the last year. But that is just the most obvious symptom of a child born with Zika. Now scientists are noticing some children who don't show symptoms until after birth. Studies are underway to determine if the timing of the infection during pregnancy affects the severity of the abnormalities. You can check out KXAN.com for mosquito prevention tips and symptoms and warning signs. We also have tips for families thinking about pregnancy, how they should avoid the Zika virus.